Thank you, Dr. Kessler. Thank you, Dr. Harris. Thank you, Ross. As we keep hearing, opioid abuse is among the most pressing public health issues we face today. Prescription painkillers are highly addictive, and once someone is hooked, they often turn to heroin because it's cheaper. But the consequences are even more severe. The White House is taking notice of this growing epidemic. Take a look.
So this crisis is taking lives, it's destroying families, it's shattering communities all across the country.
125 Americans now die each day of drug overdoses. 78 of them are from opioids. This meant 47,000 Americans died from drug overdoses in 2014. Overdoses are now the leading cause of accidental death, even more than car crashes. The crisis is both recent and staggering. Prescription painkillers account for 40% of overdose deaths in this country, and it's hard to get clean once you're addicted. Roughly half relapse. Life-saving remedies to opioid overdoses, like naloxone, are now available, but these drugs can't fix a nationwide epidemic. Prescriptions for opioid painkillers are skyrocketing. In 2012, 259 million were written for these drugs. That's enough to give a bottle of pills to every American adult. Washington is starting to pay attention. The president is asking for $1.1 billion to fight opioid abuse. Will it be enough?
The person charged with answering that question is Agricultural Secretary Tom Vilsack. He's leading the administration's interagency effort to combat heroin and opioid abuse in this country. Secretary Vilsack is painfully and personally familiar with these issues. Long before coming to Washington, before becoming the governor of Iowa, he watched his own mother battle chronic addiction. Now the secretary is here to talk about what he's doing to fight this growing crisis, and he's here with the Atlantic's Scott Stossel.
Well, thank you, Secretary Vilsack, for joining us, and
you bet.
Thanks again to all of you.
Happy to be here.
And we'll get to the question that was posed at the end of that video, which is, what do we do about all this? But for starters, when you were governor of Iowa, I know that you had to deal with mounting meth addiction problems. It's the last few years that opioid and heroin addiction has suddenly spiked again, and I have some statistics here that I think 46,000 plus people died of drug overdoses in 2013. 44 people die every day due to drug overdoses, according to the CDC, and specifically related to opioids in 2014, I think, which is the most recent year for which data is available, 18,000 or nearly 19,000 deaths involving prescription opioids. Tragically happened, and that's up 15% from the year before. So I want to get to what we do about it, but what do you think caused this? And I know you've had experience as both Secretary of Agriculture, but also as governor of Iowa when you were dealing with meth problems there.
Well, I think there are a lot of causes. First of all, I think there is the issue of overprescribing, which we're addressing with better training and guidelines that the CDC just recently published. I think it's also a function of the economy in a number of areas where we see high concentrations of overdose use and abuse. You also see high unemployment. You see a changing economy, particularly in rural areas. That's one of the reasons why I think the president asked me to take this job on, because it is disproportionately impacting rural areas. 76% of the shortages of behavioral services are located in rural areas. So when you have lack of service, you have a declining economy. You essentially have a toxic mix. Then when you have a circumstance and situation where in parts of the economy people are exposed to dangerous and difficult jobs, they get hurt, they go to the doctor, they get prescribed opioids, they get hooked, and then they realize that heroin is less expensive than opioids, and they move into heroin. And before you know it, we've got a serious problem. So I think it's a combination of factors, and That's why it requires a whole-of-government approach. It requires multiple levels of government and the private sector, nonprofit sector, and faith-based communities. The entire community's got to be engaged in this, and so we're looking at a comprehensive approach to this.
And I'm sure you must have followed the research from, there was a study published in the last few months by Angus and Deaton, one of them who's a Nobel Prize winner in economics, about just the rising mortality rate among middle-aged white people, and this is clearly a contributing factor. I mean, just elaborate on that. I mean, how do these things intersect, the opioid crisis, heroin crisis, and these mortality rates?
Either as a result of the use of opioids or as a consequence with high suicide rates. Among young men, for example, in rural areas, 25 to 45 years of age, suicide is the second leading cause of death, and oftentimes it is connected to opioid abuse, and it's connected to the lack of services, mental health services. And one of the things we're trying to do is make sure that people understand that under the Affordable Care Act, there's actually coverage for substance use disorder services, for behavioral service, for mental health services. It's supposed to be treated within these health plans in the same way that a medical or surgical benefit is to be treated. Oftentimes people aren't aware of that. In states that have not expanded Medicaid, we have 1.9 million people who are in serious trouble with reference to addiction that could be getting help if states would expand Medicaid to include those populations. So it's about making sure that we get the word out, which is why we're going to have a series of meetings across the country. In states that have been severely impacted, we're going to start in New Hampshire at the Governor's Summit. We're going to move into Tennessee and West Virginia and the Appalachia area. Mississippi may very well be one, and Nevada as well, and Missouri. These are states that have been profoundly impacted by this, and regions of the country that have been profoundly impacted. Get the word out, identify steps that can be taken by state and local government officials and the community leaders, and see if we can begin the process of turning this around.
I want to get into, you've been given, you're now chair of the task force for heroin opioid addiction under President Obama. What's kind of the range of, I guess, what do you have in your toolbox for combating this?
Well, let's start with the economic aspect of this. I think it's important for us to continue to rebuild economies where we're seeing a significant increase in overdose. And we've done that. We've got a series of pillars. We refer to them as the 4 pillars for revitalizing the rural economy that expands beyond production agriculture, includes local and regional food systems, conservation in a unique way, bio-based manufacturing, bringing these economies back. It's also about making sure that we work with the medical community and the dental community to basically better training in terms of the proper utilization of these opioids. CDC just recently put out guidance. FDA is putting a warning level on the pill bottle, basically to equate people with the fact that we may have a challenge and a risk. You may be predisposed to all of this. I think one of the messages I would want to convey to this audience and every audience I speak to is that this is not a situation where we should be judgmental about individuals who become addicted. The reality is they are genetically disposed. The reality is addiction can be a disease, is a disease that needs to be treated in the same way we treat other diseases like cancer and diabetes. And once we get the judgment out of this, once we get the feeling that if somebody could just exercise a little more willpower, they'd be able to get over this, then I think we'll see a more holistic approach. So it's about expanding services. It's about working with the law enforcement community for better understanding of the utilization of drug courts and things of that nature so that we can avoid that stigma that's attached to criminalizing some of this activity. It's about making sure that we provide the resources for these services to be expanded, which is why the President is proposing in his budget additional money for expansion of services. It's about working with the faith-based community. One of the challenges, particularly in rural areas, you can have the reversal drugs that prevent overdoses, you can have the medicated assisted treatment options available, but if you don't have somebody that you can talk to on a day-to-day basis that's been through this, if you don't have an AA meeting or an NA meeting or some kind of community that you can go to for that difficult day when you're tempted, when you want to take a pill or when you want to take a drink, faith-based communities in particular, I think, have an opportunity, community facilities have an opportunity to be opened up for those kinds of community support structures. And that's an important consideration as well. So I think it's important to see this as a holistic approach.
We were talking just backstage now about how I find this research fascinating on rats, who they addict to various drugs, and some of them are susceptible to becoming addicted, and then others, if you actually change the environment, even though you're exposing them to cocaine or heroin substitutes, they actually don't become addicted, and it has to do with changing the environment. What's your view of how much of this is sort of hardwired and genetic, and how much of it is if we can actually boost the overall economy, help the prospect of people in rural America, the kind of circumstances that drive them to seek solace in taking drugs of whatever kind can be alleviated.
Well, I don't want to be Pollyannish about this. I don't think necessarily by improving the economy you're going to resolve every circumstance, but you're certainly going to, I think, strengthen prevention efforts and make sure that young people in particular don't make the wrong choice as the first choice. And then secondly, I do think the expanding services obviously is going to make a difference. You're not going to get everyone, but right now when you lose 44 people a day, there's a human cost, there is a healthcare cost, there are loss of productivity, there are criminal justice costs associated with all of this. All of that potentially could be substantially mitigated and reduced, and lives could be saved, and families could be reunited, and workers can go back and provide meaningful work and support their community. So, I think we also need more research in this area of addiction. The reality is we don't know everything we need to know about precisely all the ways in which to treat this, but I think we know enough to be able to take a more aggressive approach, and that's why the President has taken that more aggressive approach, and why hopefully the Congress will follow his lead.
And I can't know, obviously, to what degree this informed President Obama's decision to appoint you the head of and I can't remember if we mentioned this, but you're now the director of the White House initiative on opioid and heroin abuse. But you have family experience. You're adopted. Your mother dealt with addiction in a serious way, which she was able to overcome. How much does that inform how you think about the science of addiction, the experience of it, and stigma and that sort of thing?
Well, I can call up very, very quickly in this audience or any audience the memories of my mom drinking. She was abusive. She tried to commit suicide. I remember in particular, one occasion when I sort of heard a stirring outside of my bedroom, and I opened the door, and my mother was being supported by my grandmother and dad. They just were trying to keep her awake long enough to get the ambulance there. I understand this from the perspective of a child, and the judgments I made at my mom, which were unfortunate but very understandable, the anger that I had, and unfortunately, I didn't realize all of it soon enough. She passed away from cancer, but the last 14 years of her life, she did turn her life around. Our family was reunited. I almost flunked out of high school. As soon as my family got back together again, my grades went sky high. So I look at this from a perspective of the human cost. Mm-hmm. And I know how hard it is. I know how hard she struggled. I know how much help she needed. This was not a circumstance where she tried several times to stop drinking and stop taking pills. And there was always that hope, and then the hope got dashed. More anger, more frustration. And this is a tough situation, so it's not easy to do. And that's why I'm so focused on making sure we don't judge these folks. Yeah. Because that adds to the burden, that adds to stress, that creates a deeper, darker hole that these people go into, and we need to make sure that they understand that when they get to that point, and they always do, where they have a decision to make, that we are collectively there to help them, that services are available, that the faith-based community that is there, that community is there, that the medications, if necessary, are there. Right now, we can't say that in every American community. We need to make sure that we work towards that goal, and that's, I think, the President's goal. And that's why we're going to try to raise the awareness of this throughout these regional town hall meetings, so that we have more engagement from state and local officials, more engagement from the community, so that more of these folks can be saved and more families can be reunited and more of this can be prevented. And again, we're not going to eliminate every single incident, but I can guarantee you we're going to make a dent in it, and every life that we save, every family that gets reunited, that's a lot less pain. It's something I understand and appreciate. That's sort of how I think about this.
And what, in your view, helped her specifically, and how does that, what do you take away from that in terms of your own application of development of policy in your role as this task force director?
I'm fortunate enough to have a portion of a letter that my mom sent to another woman who was struggling with addiction, where she outlined the last day that she drank was December 25th, 1963. It was Christmas Day. She found herself drunk on Christmas Day. She woke up, she got on a train, she was headed towards her brother. She had separated and walked out on her family. She realized at some point in that train ride that no matter how bad she had been, that God still loved her. So there was a faith-based religious aspect to her decision to turn her life around. She went to her brother's house. Now, if that's all that had happened, I'm pretty sure that that might not have been enough. But what did happen after that was a 30-day recovery program, a service. What did happen is the ability to come back, get a job, begin to rebuild the self-esteem, be support. My father didn't divorce. They separated, so there was the reunification of the family as a goal. AA was extremely important to my mom, so she had community support. So it was a combination of everything. And there's no silver bullet here. It's a lot of hard work. She struggled, and what was particularly instructive for me is that she died from brain cancer. And what was very interesting, and I was now an adult when she contracted the cancer, and there was one day when she, because of the cancer, her brain reacted in this exact same way when she was drinking. It was really scary. I can remember literally going into my bedroom and being frightened that that mother of my early young life reappeared, which reinforced in my way of thinking that this is not about character flaws.
Yeah.
This is about something chemical. This is something about happens in the brain, and that cancer triggered something that for a short period of time allowed us to relive the bad days. She turned, the next day she was fine. So I'm just really insistent on this whole notion of not judging people, because this is tough business. It's tough business. And if the government's not there, if the services aren't there, if the medical community doesn't understand that prescribing 30 pills when you only need 5 pills, all of this is a factor, is a contributing factor. And there is a human cost, there's a financial cost, there's an economic cost, there's a societal cost to all of this. And it's a lot of it can be mitigated and prevented with the right approach. And that's what I think the president, because of my personal circumstance, I think because of the specific impact in rural areas, he asked me to take this on.
Well, I want to ask you 2 quick questions before, and I want to make sure we leave time for audience questions. And this is taking us a little bit far afield, but how did this, just a human question, how did this affect you? You were an orphan adopted by your mother.
Right.
What was this like, having to deal with this as the son of an addict?
Well, in a sense, when you start out life in an orphanage, for whatever reason, my birth mom wasn't in a position to take care of me. I was born in 1950. I know a little bit about her circumstances. She was 23 years old, unmarried, obviously not in a financial position to take care of a child, and I'm sure it was an incredibly difficult situation for her. But essentially adopted into this family, and so the good news is you're adopted, the bad news is you're adopted into a family that's going to be troubled for a while. But great lessons learned from this experience. I mean, when I ran for governor, I was really, really, really far behind, and there was absolutely nobody thought I had a chance of winning. But I remembered my mom's struggle, and I remembered the fact that she didn't give up on herself. She didn't give up on her family. And the lesson for me was never to give up on someone or something that you value. Because there's always hope, there's always an opportunity to overcome great obstacles. And, I was fortunate enough to overcome a very, very 23-point deficit in 3 weeks and was elected governor. And because of that experience, I had this opportunity. So it seems to me that in a sense, my life has come full circle. I couldn't help my mom much. and probably added to her frustration by being angry and not being forgiving as I should have been. So now I have an opportunity in this particular job for a relatively short period of time of eventually helping a family or helping an individual avoid that. And that's really what's great about government service and about working in public service, is that you get a chance to make a difference in people's lives.
Well, and last question, and I guess we need to be quick because we're running out of time, but you've got a big budget appropriation to try to work on this problem. How are you going to allocate it? And in particular, there is, the news has written a lot about whether you make available, in ambulances and EMT, buspirone, I think it's called, and some of these other drugs that actually can be antagonists to overdoses. What's your, in 30 seconds or less, the comprehensive approach to all this?
You work with HHS to basically make sure that the resources that they have available are being allocated. And HHS has had grants recently to expand behavioral service centers, expand medication-assisted treatment, expand naloxone availability. Even in USDA, we've taken a rural utility service opportunity to expand access potentially to telemedicine through broadband. And we recently did a research project where we're extension and surveying so we have a better understanding of the extent of the problem through collection of data that USDA finances. So we're looking at every single federal agency that can play a role in creative and innovative connections with the resources. The President's budget is focused primarily on expanding access to services and accessing those reversal drugs to avoid.
And is there resistance to making those drugs available? What's the source of that? I don't understand.
My sense of this is that there's not a resistance to spend the money. The question is whether or not it's new money, whether it's mandatory money, whether it's discretionary money, whether you have to cut some other program. I think that's the problem. This is not about taking money from diabetes and putting it into substance abuse. This is, I think, a reflection of there is a need here. It should not come at the expense of some other sickness or illness or research project. It is a need that we need to address, and we need to address it aggressively. That's the President's position. I'm not sure that that's necessarily shared in Congress right now.
Well, we've got a lot much more we could talk about, but let's take questions until they tell us we need to stop. So how about right there?
Sharing your experiences as a child. This has been a really helpful discussion, but what I struggle with is the timeline of support needed to make a difference in mental health and addiction issues, and how it runs counter to how quickly child development occurs in the early years and how important those years are. And my question is, what is your task force and the work that you're doing to support young children while their parents are struggling with these issues?
It's a great question. We're working obviously to make sure that treatment options are available. And that's why I mentioned the ACA and the importance of understanding the ACA coverage and Medicaid expansion so that people can access services, they can get help as quickly as possible. So if they've got young children, help is on the way sooner. Working with the education department, making sure that they understand that we're going to be seeing a series of young people who themselves start out life in an addicted form in a way because of what their pregnant mom has been doing during their pregnancy, maybe unknowingly or in some cases knowingly. So working with the Department of Education, making sure that we have an understanding and appreciation for the symptoms, the signs in child care centers and early childhood facilities, preschool and so forth, to make sure that we are in a position to provide the help and assistance. Continuing to do better training and understanding of physicians so we don't have pregnant moms being exposed to these opioids and to the extent that they are, which is creating these problems. There's a series of steps that we're taking. And I think raising the awareness. I think part of this is each of us as individuals has a responsibility, right, to understand and appreciate the medications we're taking and understand the risks associated with those medications, and to be in a position to ask physicians, hey, is this really necessary? Do I really need this? Do I need 30 pills? Could I do with less? That's why the CDC put these guidelines together. And I think it's important for us to get the information about the guidelines out and about so that physicians, family docs are fully aware, dentists are fully aware of when it is appropriate to prescribe these medications and the risk associated with prescribing them and the entryway that they create. So it's a combination of trying to prevent it, trying to deal with overdoses quickly, making sure that we are in a position to help kids at a very early age if they are negatively impacted by this, and then providing the mental health services across the United States, particularly in rural areas. Now, we have interesting competition with HHS at USDA in terms of how many mental health services we can help to fund. People are often surprised when they find out that USDA actually has funded 80 mental health facilities since I've been secretary, over $280 million, because we understand the importance of having mental health services available. You can't help kids at any age unless you've got professionals, unless you have services available. So you either have to make them available by having physical locations for them to go to and get the advice and counsel and instruction, or you have to at least be able to access the experts through broadband and telemedicine, and USDA and HHS are both investing in those kinds of options.
So we're almost out of time. We have time for only one final question, and it must be brilliant, incisive, and brief. So if you feel confident about that, keep your hand up. How about right here?
Thank heavens the answer doesn't have to be all that.
Yeah.
Thank you, Mr. Secretary. Very quickly, a contradiction. I like your comments. In South Florida, there is a proliferation of treatment programs feeding off the ACA, feeding off parity, huge abuse by treatment providers working with people who obviously have addiction in the opioid, heroin, etc. Thank you.
Well, look, if there are abuses, they obviously have to be addressed. But that doesn't necessarily mean that we should disregard the impact and the effectiveness of medication-assisted treatment and the opportunities that it can create for turning lives around. Nor should we ignore the fact that there are too many areas in this country today where those services aren't available at all. So if there's abuse, then we obviously have to address it. If there is a misallocation of resources, that needs to be addressed. But it doesn't necessarily provide a reason or a justification for not investing in additional areas in the country and not providing services that are needed.
Well, thank you, Secretary Vilsack, and thanks to all of you. We could talk a lot more, but